This is your 420 Radio News for Monday, December 2nd, 2013. I'm Russ Belville. Massachusetts activists push to fully legalize marijuana, from Boston.com. Pro-marijuana activists in Massachusetts have already succeeded in paving the way for dozens of medical marijuana dispensaries and decriminalizing possession of small amounts of the drug. Now, many of those same activists have their sights set on full legalization of marijuana for adults, effectively putting the drug on par with alcohol and cigarettes. The group Bay State Repeal says it's planning to put the proposal on the state's 2016 ballot. The group is first planning to test different versions of the measure by placing non-binding referendum questions on next year's ballot in about a dozen state representative districts. Bill Downing, a member of Bay State Repeal, said that the state should legalize marijuana for many reasons, especially since the use of marijuana no longer carries the stigma it once did, and many people smoke the drug despite laws against it. Iowa lawmakers still seeking medical marijuana law, from GlobeGazette.com. Legalizing medical marijuana will again be debated in the upcoming legislative session, though Iowa lawmakers have so far been loath to embrace a policy that is spreading in much of the country. Democratic Senator Joe Balcom of Iowa City said he will pursue legislation seeking to legalize medical marijuana in 2014. Balcom said he plans to offer two bills in the next session, one that would reclassify marijuana as a drug with medical benefits, and one that would create a medical marijuana program modeled on the system in New Mexico. A 2010 poll conducted for the Des Moines Register found that 64% of Iowa residents favored legalizing medical marijuana. James Backstrom opposes medical marijuana use, from the Minneapolis Star-Tribune. Expecting some state legislators to try again next year to legalize marijuana for medical uses, Dakota County Attorney James Backstrom has reaffirmed his position against it. Quote, "The simple fact of the matter is that marijuana is not a medicine," Backstrom said. "Rather, it is an addictive drug that is the most widely abused controlled substance in our state and nation. In every state where legislation of this nature has been adopted, serious problems have occurred. It would be a serious mistake for Minnesota to not learn from these problems and adopt legislation allowing marijuana to be used for medical purposes." End quote. Legislators approved the legalization of medical marijuana in 2009, and it was vetoed by then-Governor Tim Pawlenty. At the legislative session last year, about 40 legislators in both parties, including more than a dozen committee chairmen, worked to add Minnesota to the list of 18 states where it can be prescribed for medical purposes. Proposed legislation would allow doctors to prescribe up to 2.5 ounces of marijuana for patients suffering from debilitating medical conditions. Mark Dayton, the current governor, has opposed medical marijuana because law enforcement officials oppose it. If it were passed again, he would be in a position to veto the legislation. Underage enforcers will try to sting new pot stores, from the Seattle Times. A select group of minors will go into Washington's new legal pot stores on a covert mission to try and buy weed for the state. To curtail youth access to legal marijuana, state officials want to use minors in pot buying stings next year when stores are expected to open. Stings appear to be warranted in alcohol enforcement. Data for the past 17 months show that alcohol retailers had an 85% compliance rate in youth stings. In other words, for every 7 times minors working for the state tried to buy alcohol in stores, bars, or restaurants, they succeeded once. The state now hires 18, 19, and 20-year-olds across the state to use in alcohol stings. About 30 minors, both men and women, work for the liquor board. They get paid about $10 an hour. When asked for IDs, the minors would provide their real IDs. In Washington, those under 21 have driver's licenses with a vertical design, unlike licenses for adults, which have a horizontal layout. The penalty for a first offense is a 10-day suspension of a store's license or a $2,500 fine. A second violation in a 3-year window would lead to a 30-day license suspension. A third violation in 3 years would cost a business its license. The clerk also could be charged with a felony, as it remains a crime to furnish minors with any kind of pot in Washington. New process detects contaminants in marijuana, from CBS Local Denver. The microscope at the University of New Haven said at 10 times magnification shows a marijuana leaf covered with dozens of tiny bumps. It's mold, and someone somewhere could be smoking similarly contaminated pot and not have a clue. Heather Miller Coyle, a forensic botanist and associate professor at the university, and her students earlier this year began developing a new process to detect contaminants in marijuana through DNA profiling and analysis. A number of labs across the country are testing marijuana for contaminants using different methods. One study released earlier this year found that pesticide residues on cannabis are transferred to inhaled marijuana smoke, possibly posing a significant toxicological threat. End quote. This has been your 420 Radio News for Monday, December 2nd, 2013. I'm Russ Belville. When we come back, we go behind the headlines to look at a leaked document from the United Nations showing how Latin America and Europe are pushing back against prohibition. You're listening to The Russ Belville Show on 420radio.org. We'll be right back.